Yes, it's been in the news that that they're going to raise the price of alcohol. Well, the medical profession's opinion that raising the price of alcohol will save lives is flawed and inconceived. Just like drug addicts, many alcoholics will beg, borrow, and steal to pay for their addiction. Raising the price of alcohol will increase the number of alcohol related deaths and crime. Many alcoholics spend money on their addiction rather than paying the rent and mortgages. Raising the price of alcohol will result in more people becoming homeless. People will die of the cold because they cannot afford heating. They will go without food and new clothes because they are spending so much on alcohol. I blame the recession on the high taxes on cigarettes and alcohol. People who smoke and drink have no money left at the end of the month to buy anything else. Drinking sensibly is actually good for you. Raising the price of alcohol will mean that many people who drink sensibly but are on a tight budget will no longer be able to afford a civilised bottle of wine with their Sunday lunch. If the government is really serious about tackling the abuse of alcohol, they need to provide help for people with addictions instead of hurting people in their pockets. Making smoking and drinking alcohol a prerogative of the rich and famous only serves to fuel the appeal on young, impressionable minds. Better to have informed campaigns designed to instill in people that they are more likely to succeed in life if they are free of addictions. Instead of focusing on negative aspects of smoking and drinking, it would be better to focus on the benefits of giving up. Television is a powerful medium that seeps into our subconscious. Why not show positive information films by ex-alcoholics and smokers who have improved their lives and achieved success in life after giving up their addictive habits? If you keep telling people how bad smoking and drinking is, it merely heightens anxiety in people who know they are hopelessly addicted. Raising prices and taxation is holding people to ransom who desperately need help, not punishing in their pockets. Hypnotherapy has proved useful in helping a lot of people overcome addictions. At present, it is not available on the NHS. Members of the medical profession quite often ridicule alternative therapies, even though many times they help people the medical profession have offered no hope for. Hypnotherapists can use aversion therapy or plant suggestions in the mind that cause a rewiring in the brain that can change and alter destructive behaviour problems. Many people who misuse alcohol, drugs and smoke cigarettes are self-medicating because they suffer anxiety or depression. Sometimes people use alcohol to forget painful memories. Hypnotherapy can help with all these issues. There's been a lot of panic about restructuring the NHS and talk about privatisation. I would like to see people offered services like hypnotherapy and other complementary services, particularly where conventional medicine has failed or has been unable to help. It's time the medical profession stopped trashing the competition and started thinking about their patients' welfare uppermost. Professional medics often claim that alternative medicine only helps on a psychosomatic level. Does it help? Does it matter if it helps at all where conventional medicine has failed? Perhaps giving GPs fund holding is not going far enough. How about giving patients control? Patients could be given a budget based on their diagnosis to spend on whatever treatment they wish to try, whether it be NHS, private or alternative medicine. I certainly wouldn't begrudge putting some money towards my treatment of choice if the government was putting money in as well. Keep raising taxes and prices of substances people are addicted to is not helping anybody. High taxes on cigarettes and alcohol is akin to stealing candy off a baby. Many people suffering from addictions feel they have no choice but to go without other things to pay for the substance they are addicted to. Many desperate people turn to crime to fuel their addictions. Increasing prices and taxes on addictive substances is making more people homeless, increasing crime levels, and increasing substance abuse related deaths as people turn off their heating and stop eating proper meals to pay for their addictions. People need help to overcome addictions. Punishing them in their pockets is cruel and is not benefiting society as a whole. If the government really cared about the health of the nation, as they claim, they will start offering help to addicts in the form of counselling and hypnotherapy, instead of driving people deeper into despair by hitting them where it hurts, in their pockets.